Next up, we have Dr. Hotland, who's joining us from Healthy People, Healthy Planet project in Indonesia. And it is very early in the morning for her. So we also thank her for making the effort to be here.
Thank you, Tamara. Thank you for giving me time to present and update our progress. And we are so grateful for the work that we are supported by HealthServe Australia. I would like to share with a little bit of PowerPoint to give some more background of our update. Thank you. Yes, as our approach is integrating healthcare incentive to enable people to be the guardians of the forest in protecting one of the biodiversity forests that remain in Indonesia. As we know, global problem now is deforestation, and Indonesia has highest rate of deforestation. And deforestation relatedly to the well-being of the community and also the challenge that people facing who live by the forest. Our approach is integrations of 3 different pillars that we always want to apply in our work. Our 3 pillars is always integrated approaches. There are 3 of them: education, healthcare incentives, and livelihood training. Because the deforestation in Indonesia and also all over the world is a very complex issue, and we need to approach with 3 different approach: education and things that the community needs, and also economic empowerment. Healthy Planet Indonesia has opened a new site in Batang Toru ecosystem, which is the south of Lake Toba, which mostly predominantly Christian community, but located in one of the precious and high biodiversity forests in the world. But it's also face of deforestation because of the community depend on that forest in a negative dependence. So we have been doing this educational on health and environment. With the help of HealthServe Australia, we are enabled to give this education that we integrated with the local activities. So in these pictures, we did this education on health and environment for schools. We try to implement our work that integrated with already exist social structure. So we don't want to build a new system for our program, but what's already available, we try to integrate. So our educations, we integrate with local schools, and also we integrated with a church. So instead of designing and asking them to come on a different time, we implement with what already structure meeting and regular social happening in the village. So in this picture also we did socialization also after Sunday service. And usually for many organizations, when you invite people, you give them some cash for to give them like transport money. But for our implementation, we want to give a bigger impact for the community. So instead of giving them transport money to attend the meeting that we invited them to come, we give them other things that more benefit for them and have long-term impact. So for this like education and socialization meeting, we integrated also with distributing reading glass for the community. As you can see in these pictures, after the service, Sunday service, we did our education on health and environment. And also after that, we invite the elderly people to get their eyes checked and to get reading glasses for them. So especially for this old community, for them, it's hard for them to see Bible, to read Bible. So this reading class really helped them to be able to read Bible again. They said that, oh, because of this class, now we will come to church more often, because now we can read the hymns and the Bibles. So we want to give the impact of more than one impact of our work with the community. So education and integration with other things that the community needs. And in the first trimester of our work, we also work with our local dentist association in the region, because we didn't have yet a clinic established for the community. So we reach out to them, and together we provide Oracle reach out that give this oral health screening for the community. And also we did basic dental care for the community who need a dental treatment. And also for the economic empowerment, because one of the things that make the community involved in illegal logging is the economic need. They have a limited income from what they already have. And also now there is a big need for making their own fertilizer, because the fertilizers is getting more and more expensive. And also it's a global issue that I also just learned that most fertilizer also has imported material. So the community really need this training so that they can make their own fertilizer that will increase their income, because now they don't have to buy a fertilizer which is very expensive. So we had this few organic farming training, so they can make their own fertilizer, and also they can make their own pesticides from organic, from everything that material that they can gather from their surroundings, so like grass and household waste, that we train them to try to make this resource that's available around them to make compost and to make pesticides. And also we train the community for agroforestry, and this is enable them also to see if they can find other source of a plant that they can plant for longer term for their economic empowerment. To enable us to do this, we also work with local partnership, with local university. And in March this year, we signed an MOU with local university, agriculture department. So they gave us this semester 5 students. So these 5 students give technical assistance in agriculture for the forest community in Batang Toru ecosystem. So we also work with local government, because the local government is our very important stakeholder, and also we work with local institutions. So this year we have been have few meetings with local stakeholder, Department of Health, Department of Environment and Forest. And in these pictures, we had meeting with the head of the region of the place that we work. And he really welcome and want to work close together with us in improving the life of the people in the region, and also to conserve the remaining forests that exist in this region. This recently also, with the help with HealthServe, we are able to start our satellite clinic. And this pictures is a little building that provided by the community. This little building was used to be a COVID post, and the head of the village gave us this facility to use as a post for basic oral health for the community. So we provide this service for the community who live directly next to the forest, and the community can pay with seedlings that promote forest protections. So we had few meetings with the community, and the community were so grateful for this service. They have been no dentist for at least 8 years, and our service there will enable them to have better care for their well-being. This is one of the patient that I just met this past week, and I also learned that in this community there is a high number of stunting kids. A few weeks ago, I met with the doctor who is the head of the local government clinic, said that stunting is a very high number, and it's a quite problematic health issue in this region. So the mother brought this little boy to our clinic, and the mother said that he has had toothache for a very long time, and because of toothache, he couldn't eat well. So he's been underweight, and also you can maybe see he is almost 7 years old, but his age and his height and his weight is like 3-year-old kids. So I can sense now that this oral health care is really needed for the community because many people there really have a very bad condition of their oral care. So our service will provide a better care for them, and will enable to also to increase the overall health of the community. Our unique conservation approach that combine conservation, protection of forests, and healthcare incentive is a very unique approach that usually our metrics are not aligned with conservation donor. Secondly, it's more challenging for us to find financial and technical support. So the support from HealthServe Australia give us opportunity to act immediately and accordingly, and to help the forest community to enable them to become the forest gardens. So we are so grateful and thank you for the HealthServe Australia that enable us to act immediately and accordingly. Thank you.